Treponema pallidum. Treponema pallidum is a gram-negative spiral-shaped organism. It has a periaxial filament, so it has a cork-like motility. You cannot see it with a regular light microscope. You need to use dark field microscopy in order to see it. It is not going to grow on an agar, and it cannot survive outside the host. So all these are important points. How do you get infected? You get infected by contact, sexual contact with a syphilitic lesion, which is a primary chancre that, or an ulcer that happens on the shaft or the tip of the penis, or in female, it will be appearing on the clitoris. What happens at first, within few weeks, 2 to 3 weeks of the infection, you will get the primary stage of syphilis. And the primary stage of syphilis, you will get weak, you will get rash, you will get flu-like symptoms. You will have generalized, or well, maybe initially regional lymphadenopathy in inguinal area, but you will get a chancre. You will get a chancre which is painless. It is not associated with pain. It looks like a pimple initially, and then it starts ulcerating, and then it disappears. It heals on its own, and that's it. You're done. You have no symptoms. But that doesn't mean the infection is gone. Anywhere between, couple of weeks to a year, you will have symptoms of secondary syphilis. And these symptoms include fever, fatigue, and you will have rash. And this is very important. The rash is maculopapular, and it's very important because this rash will actually cover your palms and the soles. So you will have rash on your palms and the soles. This is very characteristic. You may have these warty growth like appendages on, you might get them on the perianal region. You may get them on different parts of the skin, and these are basically associated. They're papular, they're warty-like. You may get them between skin folds, but they're more commonly seen in the perianal region because that is where most of the sexual contact has occurred, and there will be generalized lymphadenopathy. But again, like the first stage, like the primary stage, the secondary stage will resolve also, and you will have no symptoms. And for most people, you enter something called the latent stage. And during that latent stage, you will convert, you will seroconvert, and you will have no symptoms of secondary syphilis, and that's it. And you will be asymptomatic, and this may last for a long, long time. And this may actually be the end of it. You are infected, but you will have no symptoms. But for some patients, they will enter into something called tertiary syphilis, where you will have cardiovascular manifestations, and the big one would be aneurysms. You might have aneurysms that dissect because of the involvement of the medial layer or the intimal layer of the vessels. And that becomes a problem if your aortic aneurysm dissects. This is a medical emergency that has to be treated promptly right away, or you will die. The other big complication would be neurosyphilis, and neurosyphilis manifests as something called pabes dorsalis, where we have an involvement, a demyelination affecting the dorsal column. So you'll lose sense of vibration and touch in your extremities, and that actually gives you proprioception problems and a gait problem, because as you walk, you're unable to feel exactly where you're stepping on. The treatment for syphilis, it depends. Or in general, it is penicillin G. So it's an injection of penicillin. During the first primary phase, it is a one injection intramuscularly of penicillin. During the secondary, several injections. During the tertiary, then we are talking IV penicillin for a long duration in order to make sure that the infection has resolved. And you have to do obviously spinal a lumbar puncture to make sure that the CSF has cleared from the infection. If someone is allergic to penicillin, you actually want to try to desensitize them. But even if that doesn't work, then tetracycline, specifically doxycycline, actually may be used instead. But again, the drug of choice would be always penicillin G. How do you diagnose syphilis, treponema infection? You diagnose it by looking for using a test called FTA, free treponemal antibodies. Write it down. This is the gold standard. This is what we use. This is the most specific test that we use considering the expense. FTA, free treponemal antibodies. That is what we use. Do not look for any other test. VDRL, which is often used for venereal diseases, will actually detect it. It is sensitive, but it is not specific. It is not enough to diagnose. So VDRL will give you a positive result. It is sensitive. It is not very specific because VDRL is positive in a lot of presentations. However, free treponemal antibodies, FTA, this is the most specific test that we are going to be able to use.